Hello, everyone. My name is Alana Holsapple, and I'm a third year at Wright State School of Professional Psychology. And today I'm going to talk to you about the interplay between family systems and child behavioral challenges. Disruptive behaviors are among the most common reasons for the referral of young children to mental health clinics. Past research highlights the parent-child relationship as a key contributor to emergence and maintenance of disruptive behaviors. When a child presents with a diagnosis of a disruptive behavior disorder, it is crucial to analyze the parent-child relationship. There will likely be limited change in a child's behavior if treatment is individually focused. Instead, parenting behaviors should also be addressed. On the left side, we have outlined certain behaviors that are often labeled as defiant, and then on the right side, we have the common diagnoses that are correlated with these behaviors. As you can see, a lot of these behaviors could be explained by a multitude of things, which is why it is important to look at the context in which these behaviors are occurring. There's some controversy around the diagnosis of disruptive disorders and what should be included as DSM criteria. When looking at conduct disorder and oppositional defiant disorder, diagnostic criteria is solely behavioral and does not account the full context or emotions that the child may be experiencing. These diagnoses may label children as deceitful and disruptive, which sometimes may be the case. However, in many cases, children are misdiagnosed due to a lack of integrative evaluation of the child's environments. These types of diagnoses can also lead to segregation of children and a lack of access to care due to stigma. Parents can become frustrated when trying to discipline children with disruptive behavior and can fall into maladaptive patterns. In this diagram, we can use an example of Billy, who is having a temper tantrum at the store because he wants chocolate. Billy starts the tantrum, is threatened from his parent that if he doesn't stop, he will be grounded, and Billy continues to have his temper tantrum and then is threatened again when being grounded or something worse. Billy persists, and by this time, the parent just wants Billy to stop yelling in the store. So, Billy gets his chocolate and he stops screaming. However, Billy just learned that if he keeps doing a quote-unquote bad behavior, he can still get what he wants. His parents are reinforcing his bad behavior without even knowing it. Parents also use harsh punishments for less harsh behaviors, which can make the child upset and escalate their externalizing behaviors. So we need to inform parents of these types of maladaptive patterns so they can understand their previous ways of parenting and how to adjust for the future. Parental stress tolerance is important to address, as low stress tolerance can make parents lash out at their child whenever they are met with small inconveniences. If a parent is better equipped to handle stress, then they can approach situations in an adaptive manner and model how to cope with stress for their children. Similarly, if a parent solely views the actions of their child as intentional and deceitful, they are more likely to give a harsher discipline. Other factors to consider include physical and sexual abuse history of the child, as it's been linked with oppositional defiant disorder and attention deficit hyperactivity disorder, as well as safety within the home, neglect, and lack of attention and structure. We need to prioritize integrating family systems with individual treatment of children with behavioral concerns. A child does not fully attain the developmental capacity to be able to change their behavior on their own. Parenting interventions include the Positive Parenting Program, DBT parenting component, and parent-child interaction therapy. These programs address parents' own emotional regulation and encourage modeling behavior and positive reinforcement, as well as strengthening the parent-child relationship. Child interventions include the Treatment Program for Children with Aggressive Behavior, a CBT model, DBT to address emotional regulation and interpersonal skills, play therapy, and social skills therapy. These interventions will help focus on the child's emotional regulation and teach them coping skills to relax themselves and better communicate with others. And here is a QR code of our references and our contact information, and please let us know if you have any questions. Thank you.